Also, congratulations to Jerome Beauvais, who is the brain after this Presbymania meeting. He started his first meeting in Switzerland, I think, more than 10 years ago. Okay, let's start something different now. Psychology, patient satisfaction between male and female after multifocal implantation. Patient satisfaction between males and females. Is there any difference? Are there any differences? Are the differences important? Are males and females different? We'll try to prove that. Do males and females see differently? And is the degree of satisfaction after multifocal IRL for presbyopia different between the sexes? Let's look at some male and female celebrities. Are males and females different? So let's look at some celebrities. We'll start with Britney Spears, and we'll show you for the men, we'll start with Johnny Depp. You will have remarked some differences, besides the fact that the men are wearing spectacles and the ladies not. There are also other differences, but of course. Question number 1, we have the answer. Question number 2, how do women and men see each other? How do women and men see each other? The average man will spend almost 43 minutes a day staring at 10 different women. That adds up to 11 months and 11 days between the age of 18 and 50. But researchers also found that women sneak a peek at 6 men for just over 20 minutes a day. So there are some differences again. But most importantly, women like to look at themselves. Now what is this? A man will say, this is a Lamborghini Murcielago, this is a Porsche 911, this is a VW, and this is a Ford. But my wife will say, these are red cars. So there are very important differences. Males and females see differently. And is there also some organic correlation? Karen Emmons at the Aachen University, she studied, she had a scientific approach. She studied the differences. And she found out that women's brain had a thicker cerebral cortex in the vicinity of area 17-18. And in this area, visual impressions as contrast and edge precision are processed. The area for perception of movement was larger in male subjects. Is there a different color appreciation between males and females? This was also studied by several scientists, specifically by Anya Hulbert in the US and Tischkopf Heller in Germany. Men and women see the world in a different way. Let's look at the favorite colors of males and females. Here we come out at number 1 is blue, 42%. Now let's look at the differences between the females and the males. For females, the blue is 35%, for males it's 57%. And when you look at the purple, there is no purple preference for men. This is something different, not the real topic, but maybe interesting since we are talking about psychology. Psychologist Daniel Niesta have a question. Imagine that you, men, are going on a date with this person and have $100 in your wallet. And you have the same lady with a red top and with a blue top. How much would you be willing to spend? So the men would be willing to spend around 90 US for the same lady with a red top, and they would spend less money for the ladies in blue. So this is about psychology. Now let's come back to the topic of the lecture. Do women and men have different preferences as regards visual acuity at near, intermediate and far? And you can already see the outcome. You have the result. The reading distance, when they look at the journal or the newspaper, is different. Also for their usual habits, their their distance, their working distances are different. Men farther than the women, they come much closer when they have to work on the mirror, for example. And this is also proved scientifically, because in the British Journal in 2009, Helen Stancy did a study. She asked 24 men and women to use a laser pointer to mark the midpoint of lines on a piece of paper, half a meter away and 1 meter away. And then she recorded the place where they pointed to. And the men were found to be more accurate than women at marking the middle of the lines when the target was far away than when it was close. Women were more accurate at finding the midpoint of the line when the target was close to them than when it was further away. And she concluded separate pathways in the brain process visual information from near and far spaces. The near pathway is favored in women, and the far pathway is favored in men. And these sex differences in visual processing may be a result of our hunter-gathering evolutionary legacy. And when you go back to some paintings, to some carvings in Schöningen 400,000 years ago, you will see there men hunting, so they have to use their distance vision for hunting, and you will see also the women carving the meat and start cooking. So they will prefer to use their near vision, or they will force to use their near vision. Now let's come to the numbers, as Johan de Lange asked for, and we studied the outcomes together with Dr. Rau, Magda Rau from Gam, Germany, who has an enormous experience in multifocal lens implantation, and we looked at sex differences. We reviewed a total of 1,815 multifocal IOLs, all kinds of multifocal IOLs, the majority we have techniques, different styles, also resume, restore, and acrylisa. When you want to look at all the data, you can order my book. It just came out, and it will give you all the details. And besides that, Johan de Lange has an important chapter in this book also on psychology. How do we appreciate beauty? So let's come back to the subject. We looked at the patient satisfaction, the very happy patients, and the dissatisfaction, the dissatisfied patient with the need for explantation. This was an earlier study in 2002, and you know that in the meantime the multifocal lenses improved. In 2002, in this group, we had 30% very happy, 64% happy, and 6% unhappy. The unhappy numbers came down a little bit, but it would be similar. Now, we looked then at the very happy as the 30% very happy patients. And what did we see? Were there any differences according to the sexes? Sure. All the very happy patients were female. Not one of the male patients was very happy. Many were happy, but not one of them was very happy. Then we looked in this whole series of 1815, not 1815 explantations, but 1815 eyes, and about 50% males and females. We looked at the explantation rate. They all had a follow-up of more than 2 years. Most had a follow-up of 5 years and more. Explantations, 10 out of 1815. And out of these 10, only 1 female. 9 out of the 10 were males. And why the explantation? Because the distance vision was not good enough. We have demonstrated that men favor distance vision and women use more or favor near vision. The men wanted the explantation because their distance vision was not good enough, and also because some of them had halos and glares, etc. So very, very important differences. Psychology requirement. Women, for women most important is excellent visual acuity at close range. And of course, for aesthetic reasons, they want to get rid of reading glasses. Men want perfect distance vision and are much more critical about halos and distance vision. So, do you want these ladies, do you want to see these ladies, starting with Cleopatra, Brigitte Bardot, and Sophia Loren, with glasses or without glasses. We prefer them without glasses, and they also want to be without glasses. So conclusion, are women more patient? Do they have more time and are they more patient to get used to a kind of neuroadaptation? Probably not. But women are trying at all costs to adapt so that they look younger. So our conclusion, the satisfaction degree was much higher for females compared to males, because they wanted to get rid of glasses at all costs. If they had some glare and hairless and secondary effect, they did not care. The men cared much more. They wanted perfect distance vision, and we had, remember the number, 90% of the explantations were for males and only 10% for females. Thank you very much.
Thank you, Dr. Bruce, for putting a smile on at least 50% of the people present here. So this, of course, is contradictory to what Dr. Johan presented, but I think there would be difference from place to place. There may be racial differences. There may be differences in the expectations depending upon the work that women need to do in a particular situation. So I do think that there are going to be differences, but I think that putting a scientific explanation to the final conclusion does help, because that may add to our understanding of using multifocal IOLs in the best possible situation. Are there any questions?
Yeah. I totally agree with you. I have the same problem with Presbymania, in fact, and I don't know if it's neuroadaptation. In fact, maybe women are more patient and more tolerant, and we are not like that. In fact, with Presbymania, women are good patients, men are less good patients.
Yeah, thank you for comments. Yeah, of course, it's the most important thing is patient selection and your discussion with the patient beforehand. And you're right, that's maybe the only moment where women are more easygoing than men, because they want to get rid of their glasses.
I think that always it's very complicated to speak about the difference in male and female. Congratulations. The question, in your experience, after the explantation, the people change to happy?
That's very special for the males, and the numbers were there, but 10 out of 1,815, it's not that high. But when you discuss it, you have, of course, to mention it. The men, when they had their eye explanted, some of them had it explanted in both eyes. When we explanted, it changed for a monofocal. Some of them said, when will you do the second eye? So they were unhappy with the multifocal. They wanted to get rid of it. So they were extremely happy after we explained, and they asked immediately for the second eye.
It's very interesting, these numbers, Frank. I have to congratulate you with a very good talk. But what's interesting for me is that I did not set out to compare the genders. We just looked at the numbers, and then I was looking at the list of names and at the genders, and I saw the signs, and then we started counting the differences between the genders, and that's what we came up with. My explanation may not be right, but those are the true numbers, and it's very interesting that it's totally different from yours. I don't know the reason. It may be that the near vision of the lens we used is not its best attribute. It's actually its worst attribute. That lens is not good for near vision. It's very good for intermediate and it's good for far. But near vision is where it comes short a bit, so that may be a reason.
Surely, because the women, the female patients, they prefer their best near vision, and for distance vision they are more tolerant than men. So that could be the explanation.
Are there any more questions? Thank you, Dr. Bruce. please, Dr. Boris, present and
I think I will ask Dr. Sharp to present because I think perception of Boris will be quite different when you are working with this